Hi, my name is Erin Pasley, and I am a graduate student of the Speech Language Pathology program. I am a second year, which means that after this year, I will graduate and will be out in the field with my master's program. For speech language pathology, we had to have an undergraduate degree in that as well. So I did graduate from the University of Mary with my bachelor's degree through the year-round program. I've been at UMary ever since. I actually taught Emerging Leaders Healthcare Academy for Health Sciences as a graduate assistant last year. I taught incoming freshmen. And then I was also involved with concert choir all my years here at the University of Mary as well. A few things about me is I run a local nonprofit called Youth Empowering Social Status in the Community. I work with young adults between the ages of 14 and 24, all the way up to the age of 30 that live with disabilities. I do live with an acquired disability. I have an autoimmune disorder and some chronic pain, and so I am really called to doing that. I am also a private provider in the community, and I take care of my best friend with Down syndrome. So I feel really called to working with people who have disabilities. Another thing is I also do Young Life. That's what I'm wearing right now. I work in the high schools, and I do ministry to high schoolers with disabilities and without. So I'm very busy, but speech pathology is my ultimate passion. Growing up, I actually had a speech sound disorder. I had a frontal lisp, and I also have something called a vaulted palate, which had to be corrected through orthodontic work. It means my palate was way too tall, so that's why my sounds didn't sound quite right. And I always thought, well, because I sound different, I definitely can't be a speech therapist. So, how can a speech therapist tell someone what to do when they themselves still can't do it? Well, that's a total misconception, and I've actually worked on most of it. I also had feeding tubes all through high school, and I have really felt called to being that person that I really needed growing up, and a person I still need to this day. So I'm really called to working with adults who have speech and language needs. And I know as you'll get to know me and through this class, you'll know our large scope of practice, but it's a fantastic field. I originally came to the University of Mary for occupational therapy, but through knowing my best friend and getting to know myself in the profession, speech was 100% what I'm called to do, and I'm so glad I'll do it. I actually accepted an internship position through Sanford Health, so I'll be in Bismarck Acute Care. And then in my second half, I'll be in Sanford Outpatient Care. I'll be working with adults. I have been trained in the LSVT Loud program, so I'm actually certified. I've also been trained in another Parkinson's program and several other programs that have to deal with intellectual disability and ASD. A bunch of other things, but we won't get into that now. I'm just really called to working with young adults. So if I feel like I don't quite fit in the hospital setting like I think I will, I have enjoyed working in the high school settings, which is very interesting because high school speech language pathologists at high school any services are really hard to find, and they're the most in need. So I would also be willing to work for Bismarck Public Schools in the high school setting. Of course, right now it's a little different with COVID, but we'll just see where we are in a few years when I'm ready to maybe move around a little bit. But that's a little bit about me, and I look forward to meeting you all.